CEO. She is going to walk you through some things that are happening currently about the United Way and our current process. And then when Trina is going to toss it over to Kathy Jamil, our Chief Impact Officer, who's also going to talk to you today about some of our platforms for our funding. So again, please, I encourage you, if you have questions throughout the session, put them in chat, or please also funnel them through the program funding at ubec.org email address. That's the best way that we're going to receive things and be able to answer them for you. I think that's it for now. So I am going to turn it over to Trina and we can get started.
Thanks, Amy. Good morning, everybody. I hope everyone is doing well this morning. For those of you who know us well in terms of our funding, it's been a long time. So we're happy to be coming to you this morning with our new RFP, give you a high-level view of what we've been thinking about for the last couple of years and how it turned into what you now have in your hand as our new RFP process. I want to start by saying that we recognize that this morning's news of the government shutdown may be causing some anxiety inside of our nonprofits. And that you may be thinking to yourself, I need to get off the phone and create battle plans and things, contingency plans should this last longer than a couple of days. And so we want to be respectful of that and respectful of your time and try to be as concise as possible. As Amy mentioned, what we really want to do is to be able to answer questions in an FAQ so that everyone can benefit. So if you please, would put your questions in the chat. We've collected your questions through Zoom. And we'll get that posted, as Amy said, as soon as possible. And we will keep updating that regularly so that as you're working through your application over the next several weeks, you'll have benefit of that information. So let me tell you, as I mentioned, we have not opened this RFP up for the public for 4 years. Part of that is because, as you all know, we have always done 2-year funding. The other 2 years was about the fact that we knew that times were changing and that we needed to use our resources in a different way to support not only the needs of the nonprofit sector, but of the community as a whole. As you all know, at United Way, we have planted a flag around the ALICE population. And for those of you who may be new to us, ALICE stands for Asset Limited Income Constrained Employed. You'll never see ALICE as an acronym, though, because the important thing is for everyone to recognize is that ALICE is a person. It is our neighbor. It is us, not them. And we monitor, though, that data every couple of years. We get a new report. ALICE members are folks who have really fallen through the cracks. You know, you might think of them as the middle class, but for us, we think of them as people who are caught in the middle, people who are making too much money to receive governmental safety nets, but not enough money not to need them. And in our community, I will tell you, based on our 2023 numbers, the number is moving in the whole wrong direction. For several years prior to 2023, the number was at 40% and stayed relatively stable. We weren't happy about that number, but stable was good. But the 2023 number shows that we are no longer in that state. The number has gone up to 42%. And we anticipate that given the current environment, we are anticipating that that number will continue to grow. And so a lot of what you're going to see and what you are seeing in the application process is sort of in recognition of those facts. So I just want to kind of go over a couple of things, really give you sort of the 30,000-foot flyover of some of the changes, and then Kathy will take you into a little bit of a deeper dive. First of all, what you might notice is that there are 2 directions of travel now. One is a 1-year funding path and the other is a multi-year funding path. So what is this strange new world of one-year funding? What we want to recognize here is that there may be a established nonprofit or two that have decided that something more innovative needs to happen, and you need maybe some startup or some seed funding in order to get that thing off the ground based on whatever it is you're seeing now in your constituents. I would tell you that the key word here is think innovation. That's what we're sort of looking for or thinking that you may need some assistance with. And so have that sort of in your mind as you're deciding, is it 1-year funding or multi-year funding that I need? With the multi-year funding, the 2-year path is more what you're accustomed to from us, that we'll be looking for you to tell us about the impact of your program and give us a sense of what the budgetary needs are going to be. Keep in mind that United Way's money is never meant to be the end all be all money, that if that money weren't there, the program can't go. That is not what our money should be used for or budgeted like. And then finally, the 3-year path, that is for system change. That's that lane. That lane it's not about just 1 or 2 or 10 or 20 people that I'm helping, though that is important. That 3-year funding is getting after systems. So you might think of the example of my program is designed to and intended to disrupt suspension rates. So hopefully that gives you a little bit of a sense of the 3 different types of funding that you might apply for. This year, and this year only, we have budgeted to hand out $1.2 million in this year for this round. So every year, the second and the third year, that number may change, but for this year, it's 1.2. The average grant, our best guess is that they will be somewhere between $25,000 and $75,000. The important word here is average. Keep in mind the 1 and 3 year is new to you. It's also new to us. And so we will want to take a look at all of your fantastic applications and all the fantastic work you're doing. And then what we will do then is try to put together a puzzle to say, these things are not all independent of each other. If we put this program together with this program together with this program funding, then, we can see now what the benefit would be to the overall community. Not that you all are always working together, although we certainly hope that you do, but that when we think about the money that we have put out into the community, that we can see the picture, the overall picture of how the community will benefit. Probably the biggest change is this concept of first dollar. So as you might realize, United Way spends a lot of time and resources trying to share in our fundraising efforts. And so we have folks when we're going out to do our presentations and such, and we have folks in the back room that are monitoring those and divvying them out as folks may ask us to. The word designations is what you'll probably be most familiar with. We are saying now, with first dollar, and I'll give you an example. If an organization is awarded a grant and that grant is $30,000, but that same organization gets $2,000 in designations, your total award is $30,000 coming from all of the United Way efforts. I know that's a little different of a concept, particularly for those who have been used to receiving funding from us. But truly, our goal is to drive as much money as we can into our doors so that we can push the money out into the community, again, in that shared fundraising model that is unique to United Way. The last thing I want to tell you before I turn it over to Kathy, and hopefully, team, you'll let me know if I left anything out. The last thing I want to let you know is that we are very publicly going out with a community-centered message here. Some of you who know United Way well or think you know us well, think of us about being stewards of money. We're going out to the community. And again, our call to action, our battle cry is that Alice is at 42%. 2% of a million people is a lot of people. And so we're going out trying to help folks to understand that United Way and our partners are really, really razor focused, if you will, razor focused on the issues that are facing our community. And for us, that means if a community is going to stabilize, it must have three centered pillars: healthy communities, youth opportunities, and financial security. If any one of those three is weak, so go the community. So the message that you will be hearing publicly from us, the message that hopefully people will rally around, is that we are the stewards of impact. They will trust that our over 100 years experience means that we know what we're talking about as it relates to those very three targeted, very specific things. And they should be happy, glad, frankly, that all of you and us too are focused on that in our community. And with that, I will turn it over to Kathy.
Thank you, Trina. Good morning, everyone. So glad to see so many faces and names on the screen. So today I'm going to be walking us through some of the more specific aspects of the application and the RFP. So as Trina mentioned, our three platform areas, you'll see in the RFP, there are three major buckets. That's youth opportunity, healthy communities, and financial security. Within two of those, there are two specific like subcategories. So out of the three, there's a total of 5 different types of focus areas in which you can apply for any of your programs that are aligned to that. Our programs have to serve Erie County. On the website for funding, you would see a map and it has some red blotches on it. Those are our priority areas. However, we will be covering programs based on need in the entire Erie County map. So when you're looking at the map, keep that in mind that it includes the entire county. Organizations are limited to one application per program. So say, for example, I'm running an after-school program. I wouldn't apply for an after-school program under 3 different buckets or 3 different platforms. I would basically be providing an application for one. However, you may have 4 programs that fit under the 5 different areas you could put them in, and that is okay. So you can apply for multiple programs in this cycle, but you just can't use the same program in multiple different platforms. As you're thinking about applying, so as you're going through the process, you'll see that there's a portal. This is something new for you all and for all of us. We have now gone into a new system for you to put your application questions in there or your responses. And while you're going through that process, just be cognizant that when you get to the section on the data piece, that you're really thinking about how you might be collecting baseline data. It's something a little different that we're doing. We're trying to understand where you're starting at and what you're trying to do in terms of impact. And so thinking about how you could collect information within your programs, how might you be able to be prepared then to report out in a later time. So it's already in the portal as you're going through the process and going through the questions, but just wanted to make sure folks are really thinking about their baseline data. As a general rule, programs are required to report impact or performance using a valid and reliable assessment to demonstrate impacts as a general rule. Smaller programs may be doing surveys, but even surveys can be done in such a way that are also reliable and valid. So again, thinking about the type of assessment tools that you'll be using to show impact. Any program that aligned with the strategy and outcomes related in our priority areas is welcome to submit an application. Obviously, there's no guarantee that all programs that that are submitted are going to be accepted. We're expecting hundreds of applications. So I know it's a very difficult time for folks right now, really looking for funding, but obviously we can't cover all the things. So just keeping that in mind, it is a very competitive process. This is what I'm sharing with you right now is really nothing extraordinary. Most of this, if not all of it, is in the RFP, but I do want to highlight just the deadline. It's a system, so the portal that you're in will shut down. In the past, sometimes we'll get a call, we'll get maybe if you know that person personally and at United Way, you may want to send them a text message. That can't happen anymore. The system will shut down at 11:59 p.m. on October 24th. So a request to extend will not be accepted. Applications will go through a volunteer scoring process as it has in the past, so that's nothing new. We expect between 60 to 100 volunteers in the community to come together to score all the applications. An initial slate will be completed around January 2026. So we'll have, after all the volunteers have scored, we'll have some discussions around the slate, and then we'll have a draft in January 2026. If a program or an agency has made the slate by then, at that point, the program directors will go out to your agency and come for a visit, and that will kind of take us to the second round, if you will, to kind of go through the application. So I think there was visits in the past, but we haven't done anything like that in the past 4 years. So we really wanted to make sure that people know that there will be visitors coming to your agency to see the program, live, if you will, sometime in January of 2026. And then the notification of awards will be announced mid-May of 2026. Funding would start July 1st. And that's all I have. So at this point, I'm going to hand it over to Patty, who has kind of been looking at the different questions coming up in the chat. So if you haven't already had an opportunity to ask questions, by all means, go ahead and put them in the chat, and Patty will take it from here.
I actually don't have questions that haven't been that weren't super easy to answer via a chat message. So if anyone's got questions, you're welcome to put them right in the chat, and we'll address them if we can. Everything will be posted on the website, including the questions that folks submitted in advance of this webinar, so that everybody can sort of be reminded of what the answers are, even though a lot of that information was covered today.
And this recording and frequently asked questions we put on the website, so you'll see this again and kind of hear it again if you want. But the questions also that we've been collecting from the registration, some program funding emails that we've been getting, they've all been collected and they will be put on the website because a lot of your questions are relevant to most people in this room.
We actually do have a couple of questions. One, I think I can answer. There was a question about an art services organization that provides services that benefit holistic health. Basically, any programs that are aligned with our focus areas that are outlined in the RFP are eligible for funding. It doesn't matter. The primary focus of your organization is less important than the focus of the programming that you provide. So if your programming aligns with our focus areas, absolutely apply. Obviously, we can't guarantee funding, but you're welcome to compete. And then the second question, and I think I'll turn this over to Kathy, is can you give any more examples of the 3-year projects we might be interested in?
Yeah, certainly. So as Trina mentioned, the 3-year really is focusing primarily on, not entirely, but primarily on system change. So it could look like a few different things. If there was the suspension example that Trina gave, but if you're thinking about maybe partnering with another organization and say you're on a coalition and maybe 3 members of your coalition, so different agencies want to do a shared program to focus on some advocacy efforts that would help ensure that all children get opportunity to something that's going to change a system will take a higher priority than one that is running a program and a necessary program, but nonetheless, a 3-year is more really focusing on a change. And we understand system change takes time, and that's the reasoning behind the 3-year process. Really looking at either partnering with another organization or doing something on your own, but at the same time thinking about how is this program going to change a system. And there are lots of parts of a system that can be changed in a complicated situation, right? Like we did the suspension race. I think so. The suspension race is a really good example because there's so many things that have to happen in order for something to change. And so what might be those things? An example would be MVP, Most Valuable Parent in Buffalo Public School District. They go to homes and they actually work with parents of students that are suspended, and then they help them prevent suspensions in the future by supporting the families and advocating for them at the school. That would be a program that's focusing on system change. I'll just give you a quick example.
Great. We actually have a little flurry of questions coming in. So there's a few that I'll address very quickly, and then one that I'll turn back over to Trina for a little bit more information. Sorry, I'm just trying to keep up with it. Our office is located in Gowanda on the Cattaraugus County side, but we serve rural communities in southern Erie County. Are we eligible to apply? If you are serving residents of Erie County, you are absolutely eligible to apply. Next question, I saw, sorry. To be clear, a CDO can submit more than one application as long as the program falls under different priority areas. You can submit one application per program. If you have multiple programs, you can submit multiple applications, but they all have to be for a separate program. Even if your program falls under one particular area or more than one area, you just select the one that is the best fit. I'm going to kick over to Trina. Can you explain First Dollar further? Previously, donor designated gifts were not restricted, but the grant will now restrict these gifts, correct? Do the donors know that this will be happening?
Thanks, Patty. I'm not sure about the phraseology around, they were restricted and now they aren't. However, what I'll just say to this group is like all of you, we have to take a look at what all of our available resources are. And you might not think much about how the sausage gets made, but there are many, many employees in this building whose job is focused around the processing of designations. It's really quite labor intensive. And so the decision was made that we would adopt this First Dollar concept, which is really a United Way thing and has been for decades around the country, to say that we want folks to recognize that we are a health and human services agency. Our partners are the same. And that when those dollars come in to funded partners, that we are going to send that money out as instructed, and also include it as part of the overall funding that we are giving out, or sharing, if you will, with organizations. Donors, we are not sure that donors actually need to be aware of this change, because it is such a widely accepted policy and practice of United Way. But I will tell you that we are committed to the work that we're all collectively doing. If folks are giving you or designating funds to you, rest assured it's still coming to you. I will also tell you that, because some may be thinking this or thinking about asking this, the two decisions are separate from each other. The investment or grant decision is totally separate from anything that's happening on the finance side. So we make the decision about your grant, and then we want to maybe take a look then at whether or not your organization is getting any, sorry, I got distracted for a second, whether or not your organization is getting any designations. So the two decisions are independent of one another. And again, I cannot emphasize this enough. Our collective message, so that's just not United Way. I'm saying us collectively as health and human service organizations that are focused on making the community better, we all need to rally around a community message that is talking about, if you don't have the Alice language, we hope you will adopt it, but that the data is in the house and irrefutable, that the community is not doing well, It's only going to get worse. And those are the only thing that we can be sure of is that fact. And so we want everybody sort of going with us on this community focused health, youth opportunity, and financial security message. I hope that answered your question, despite the fact I got jet lag for a second there.
Great. I think we might have just one more question. It's actually a combination of a couple questions that are dealing with the same thing. And I'll paraphrase. In the RFP, we discussed 4 focus areas: healthy community, youth opportunity, financial security, and community resiliency. And we do state in the RFP that we're not funding programs under the community resiliency area at this point. But I'm going to turn it over to Kathy Jamil to talk a little bit more about what that's all about.
Thanks, Patty. So you may have all seen our brand refresh, where you've seen our website look very different, lively, more bold colors, and you may have seen our platform areas change in terms of some of the terminology. United Way Worldwide had added a 4th pillar. We were primarily in the past education, financial security, and our financial stability at the time, and healthy families. And so now we're healthy communities, youth opportunities, financial security, and now this community resilience platform. So these are the 4 that you will see in any United Way across the world, for that matter. And so the application process, the RFP, is really aligned to make sure we address the 3 out of the 4. Our community resilience approach currently is related to more of crisis situations. United Way across the country has responded to crises. You may have heard of United Way, say, in North Carolina last year that responded to the hurricanes. And so we do have a community resilience fund, and that fund really is to respond to crises. For example, when the blizzard of 2022 happened, we gave out significant dollars directly to the hands of families to help them deal with the crisis of just dealing with the blizzard, and whether their car was totaled, the roof caved in. And so an average of $600 given out directly to families, just to kind of give a boost. Mississippi Tomo shutdown funding was given out to individuals that were let go, or who had left or got fired, or to shut down people losing their jobs during the holidays. And so we were able to give out some gift cards for food and give out some turkeys. So we are basically utilizing this fund primarily to respond to crises. And so it didn't fit in this RFP, but it does exist in order to, again, to respond to issues that are rising in the community that are causing a significant crisis.
Great. There is one more question. Will there be a period where RFPs can be reviewed prior to submission deadline? You can review your draft in WiseHive until you submit it. And actually, I would invite either Tobias or Corey to clarify that. My understanding is that once you submit, you can't sort of open it back up. So if you really want to have time to continue to review it, don't hit submit until you're sure you're ready.
I would add that if you submit something that's obviously wrong, right? Like the final table asks you for percentages, and when we tested it out, some people thought it was asking for numbers. And so if you submit something early and there's something obviously wrong like that, we can return it to you, asking you to redo a specific question. But we don't have the ability to proofread the entire application for you. But so if you submit it early and we catch something, we will try to get that back to you to fix that one question.
Great. Thanks, Corey. There is one more question. If you're applying for multiple programs, do you have to do one at a time, or can you have multiple in process? And I believe you can start as many applications as you intend to complete at whatever time, and work on them however you need to work on them.
And Patty, I just want to add one more comment with regard to the submission of applications. Family, the system is going to shut off at 11:59. We have no control over that. Please do not wait till 11:56 to try to start hitting submit. It's a system. We've tested it over and over and over again. I appreciate all the work my staff has done to try to make sure that this new system works, but it's a system. It always doesn't do what we want it to do. please do not wait until literally the 11th hour to submit your application. We don't want you to have any anxiety around this, and we certainly don't want folks in the community to miss out on your good programming because something went wrong at 11:57. Again, I want to thank my team. Thank you, Patty, for being our question Vanna here for the RFP. Do the best you can, folks, under what admittedly for all of us are tough situations in the community. If no one's told you recently, let me tell you that we appreciate everything that you're doing. We appreciate it. We appreciate the community appreciates it. We are not under attack. We are merely being tested. Our resolve is being tested about how we feel about our community. And I know how strongly we feel. We wish we could be giving out multiple millions of dollars. The fact of the matter is, we are not able to do that. This is one tool, one way in which we try to do our part in the community. And we love working with all of you, and we hope that that continues well beyond just this RFP process. So with that, we will give you back maybe 20 minutes in your life or so. Thank you again, and good luck to all of you.
Thank you.
You're welcome. Take care, everyone.